Okay, hi everybody. Thanks for being here. Thursday. Good news, no new deaths over the last 24 hours, so certainly it's a good way to start out the day. 7-day rolling average, 0.8, same with the 14-day rolling average, so that's kind of where we've been, between 0.7 and 1%. A really good spot to be as a community. Positive cases, 32,172 since March 16th. Which is coming up quickly. That's 48 new cases. So today's Thursday. 48 is a pretty good number for a Thursday. So we're happy about that. One new case from senior facilities. Again, part of why we've seen a decrease in hospitalizations is because that our senior facilities have not been being impacted at the same rate that they once were. So that's very good. Active cases are down to 456, so we had lots of recoveries. That's a really good number, going in the right direction there. Hospitalization numbers are down a couple, down to 47 individuals in the hospital. We have 9 of our neighbors in the ICU, so please keep them in your thoughts and prayers over the weekend as we need them to get well. So the vaccine. We have clinics tomorrow. We'll have a clinic on Monday at the On Center. We'll open up appointments for that. Likely have one on Tuesday as well. And then we'll get an idea what next week's supply is going to look like from the state this weekend. Anybody eligible in any of the categories can come to these clinics at this point. Certainly we saw the opening up of eligibility to a degree this week. Quite frankly, we could probably open it up a little bit more, but that's okay. We'll get through these folks now that have the opportunity to get their shots. Homebound residents, it was reported yesterday, I think we talked about it on Monday, partnering now, utilizing the Johnson & Johnson vaccine that we get to do homebound seniors. We directed some vaccine to Essential Health so that they can get their clients done. I think we gave them 300 vaccine doses to get their clients done. This is a hard-to-reach group, so we're going to need we're going to work with other homebound agencies. We can potentially do mobile teams, and we may look at other partners to help us get to this group. But it's difficult for us if you don't get home care and you're a homebound senior. So today I'm asking that if you have a loved one or a neighbor that is homebound and hasn't been able to get their vaccine, that you email us at covidvaccinations@ongov.net so we can start gathering information. Next week, we're going to open up, on Monday, we'll open up our phone bank lines, and we'll have a number where people can call in so we can start to get a list of residents in the community that haven't had an opportunity to get the vaccine yet. And then we'll work with our partners to get you your shot. So everybody, nobody's getting left behind in this process. This is going to it's a level of micro-targeting now that we need to do, which is good. But there's not an easy way to do it. So we have home care providers that some of them will vaccinate. We'll probably likely have mobile unit teams from our health department or some of our other partners go to these individuals' homes. It's just not as fast. If you think about it, we're used to having 1,200, 1,500, 1,800 people a day come through here. You have multiple staff in one facility. Everybody waits after they get their shot for 15 minutes. In a facility, there's only so many people you can get to in a day with our homebound population. We'll do it. We'll get to it. The Johnson & Johnson vaccine is the easiest one to use because it's a one-shot tool. The supply, remember, they had a lot of Johnson & Johnson at first. They got their FDA approval. They already manufactured a bunch. Now they're ramping up manufacturing on that. Probably, if we have any next week, it will probably be limited. And then, again, at the end of March, we'll start seeing more of that. So lots to do there. Related to the vaccine front, our community is doing very well. Going into today, we had 125,000 plus residents get vaccinated. Over 27% of the population, almost 34% of the adult population, and even a stronger number of eligible population. I don't have the eligible number, but overall we're doing very, very well. And I think that we see direct correlations with how we're performing through the pandemic now with the vaccination rates. The federal government announced today, I talked to Senator Schumer's office about the Syracuse Community Center being a federal designated partner, getting supply. We'll work with that, with the team there. We've worked with that team throughout the pandemic, and certainly we'll partner to figure out best way to vaccinate with them. Also, testing. Please, 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 symptomatic testing, symptomatic spread, big risk for us. ongov.net/Cayuga Medical to register for symptomatic testing Monday through Friday, 9 to 1. And then again on the weekends. Are we still doing, I don't even know if you put it on my notes now. I'm assuming we're doing weekend testing at Upstate again for community testing. Asymptomatic testing, again, we're doing that here at the On Center. We're doing it at community sites. And certainly we're doing it in the schools as well. You can go to covid19.ongov.net to register for that. And please take advantage of that. Today, we're at Onondaga Town Hall. Tomorrow, we're in the southern towns at the Lafayette Community Center. But this is a great tool to make sure that you are not an asymptomatic carrier or symptomatic carrier. And this is really what's helped us turn the corner. I had a question earlier from Michelle Breidenbach on Twitter about county facilities for weddings. Yes, we will do weddings. I didn't know the answer, so I had to ask the people that knew the answer. But we will be resuming opportunities for reservations at Highland Forest and Arrowhead and other facilities that people like to use. Looked like there was some updating guidance on weddings. It looks like as vaccinations increase each week, some capacity gets better, which makes sense. And hopefully some of this guidance will continue to be modified based off of the conditions on the ground, which are improving daily. So that's good. Happy to take other questions. Obviously, we're pleased with the stimulus plan. I believe the president's signing it today. That will provide us a unique opportunity to reactivate plans to address systemic issues in our community and stimulus issues. And so we're excited about that. We made a lot of tough decisions in 2020 and 2021. And so 2020 is over, right? Everything we cut or didn't cut in 2020, that's over. That fiscal year's over. We'll know what that looks like. It could look like a good fiscal year for us because we cut so hard. But now we're in 21. Remember, we went into 2021. We cut over $80 million out of our budget. So certainly we'll be able to show very easily between the 2 years that we lost more than $89 million, which is about what we're receiving. But we'll put forward an agenda later on this month related to that. Also, two notes. Clearly, Syracuse men's basketball deserves to be in the NCAA tournament. If anyone thinks that Drake or Boise State or Colorado State is better than us, you can call me at the office and we'll talk about that. But we'll look forward to Selection Sunday on that. And also, JJ. Where's JJ? He's back there to the right. JJ, you're leaving us, I heard. Thank you for everything you've done during the pandemic, preparing these briefings. And we wish you well. So thank you very much for everything you've done. Questions?
When might the vaccine site open at the Community Health Center?
So we spoke to the senator's office. Again, we don't know when the supply is coming in, what it looks like. We've had a great partnership with Mark Hall and Derek Murray and everybody there throughout the pandemic. So we'll talk to them about what they envision and where they need help. We have existing infrastructure to help them, get the vaccine out more in the community. And again, I think that's at this point, we're able to micro-target using zip code data. I think the the community health center has 3 locations, I believe, in the community. Whether or not you have sites at all 3, that will be their call. But certainly we have the ability to partner with them and get shots in arms quickly.
You've warned higher levels of government to not open sites, instead just give you the supply. I'm wondering if, because this is targeted, conceptually the way they're putting it in the community health center, it seems targeted to me. Wondering if you're more supportive of it that way, or would still prefer the supply to just go to the county.
Yeah, no, I think we'll partner with them, and I think that when we look at data, our city zip codes are lagging. Certainly, when you look at ethnic and different backgrounds, certainly we still got work to do with our African American community, our Latino community, to get the participation rates up. So this is welcome news. Again, your pop-up clinics to date have been somewhat dependent on state supply, and so this would be driving more supply into facilities within the areas where we haven't reached as well. So I'm pleased with that, and certainly we'll take advantage of that and figure out how, as a community, we can meet the challenges that we need to meet.
How is the health center picked? Is it because of its neighborhood, because of its population?
Yeah, so it's a federally qualified healthcare facility. So I think when you look at, I testified a couple weeks ago. This was a hot topic, specifically related to participation in minority communities. And so when you're looking at it, what's the best way? My argument was, give it to us, we'll get it done. That's still, I think, the best way. But your FQHCs are in these neighborhoods. It makes sense to give them more supply. Now, if they get a lot of supply, clearly they're going to need our help. They probably need our help anyways. But I think it's a great development, and I'm pleased it's happened.
Our news team is hearing that on the barriers that are going to go into schools getting shipped into the county, that the shipment might be delayed from what was originally planned for April 2nd to now April 12th. Is there truth to that? Is there any delay, or do you know?
Yeah, so I don't believe that's the case. Mary, I think we ordered some already. Some of these sources have been, I think I saw one report, maybe it was from your outlet, where there was a source suggesting we weren't paying for it, which I would say is fake news, because we are paying for it. If they receive billions or millions of dollars of federal funding, we would appreciate to get paid back, but we are paying for it. So I don't know who or what. We ordered 12,000 partitions already, and I think we showed yesterday multiple models. We're letting the districts decide what they want, and we're giving them deadlines so we can meet the deadlines which they want to do. So it's their decision to change their plans. We are happy that it looks like most of them are, but I think coming back from spring break is that deadline everybody wanted to be. But I have not heard that April 12th, unless somebody picked a specific manufacturer that they wanted that item out of the 6 or 7 that they've seen, and that manufacturer is saying, we can't get it to you then. Maybe that's the case. We'll look into it more, though. But I know that one of the superintendents that was talking on that one story that I saw was flat out wrong.
There's this idea that the students have to move them around. Is that a concern that happens successfully?
That's their call. There's most of these are stationary. If they want to move them around, I had somebody on social media suggest they could be used as a playful toy or whatnot, and it could lead into more as they're bringing them around. Sure, it could happen, but we don't govern operations inside school districts. The only reason we have what we do with schools outside of a pandemic is we put social workers and mental health workers in schools to provide services. We don't have any other jurisdiction. We're in a pandemic now, so we have a little bit more jurisdiction. But if those districts choose to use stationary partitions and mobile partitions, that's their call. We'll buy them. But how they manage that flow, again, that's their responsibility, not ours.
The amphitheater and the Landmark Theater are both online selling tickets for June shows and also beyond through the summer. Will those shows somehow go on and comply with health and safety guidelines? Do you have any insight into how those will go?
Yeah, I think so. We're hopeful that we can. I think some of those shows are probably, again, I may be wrong, but I think some of them are shows that people bought tickets for last year and they agreed to come back again next year, which is now this year. But I think if you look at the way this is trending, I don't know how. When vaccination, people, every day that we learn more about how effective the vaccine is, rules are changing, right? So now, if you're vaccinated, you don't need to quarantine on travel. So if you're vaccinated, why wouldn't you be able to go to an outdoor concert venue? And if you want further risk mitigation, you can test. So I think time is our friend with this vaccine as more and more data is showing how effective it is. But I do anticipate we'll have an amphitheater season. How many people, where you look at capacity rules and whatnot, the one thing out of our control is anything over 5,000 people, even if that's under 25% capacity at the amphitheater, but over 5,000, we need a state permit on every concert that we have. So I guess the state could say we'll cap it at 5,000 or else we won't give you a mass gathering permit. But I do believe we'll have a season at the amphitheater, and I think you'll see a pretty robust, active summer because we're making such great progress with vaccinating.
Did you get the results of the landlord survey, and were any of those results going to help you get the $13 million out faster?
Yeah, we did. So we're gonna, and we got more money in this latest round. So I think we got another $10 million. So I think I saw a proposal from my team internally. We're going to make a couple modifications, but we'll release the details of that next week, and I think we'll start getting money out at the end of the month.
Any findings you can share with us at the end?
Yeah, well, one, we're looking at, there's going to be a dollar figure cap per unit. That doesn't mean a landlord who owns multiple units can't claim, multiple issues. Again, the tenant preferably will fill out the application, or the landlord can on the tenant's behalf with consent. But certainly we will have protections in there that the landlords can't just get paid and then turn around and evict, right? There'll be certain protections in there for periods of time as well. So we're confident that the program will be effective. We want to make sure that it addresses the issue. We don't need to have it be too small that you can claim per unit and then automatically guarantee 90 days later you have a problem. But you don't want to. You want to find balance. You want to solve the problem for enough people in this situation. So this is an issue that on the housing front we work with the city on with the first part of the pandemic with some HUD money that came through. This is U.S. Treasury money. The guidelines are a lot easier to get out. So we'll get all the money out, and we may even be partnering with the city on some things in addition to that.
So you think it's going to go out a lot faster than the initial $4 million?
Oh, yeah. It's going to be, this probably will be gone in short order as soon as we put the program out, yeah.
Are you talking to schools about bringing more kids in for more days? What are those conversations like?
Yeah, so I've learned a lot through a lot of your reporting, right? So from everybody in this room. But what we wanted to do was give them tools and then hope that they did the right thing, and they are doing the right things. And everybody recognizes that in-person learning is really essential. And if we had to do this all over again, certainly I would have, what I've learned is that if we have future disruptions related to this type of issue, is we need to figure out a way to keep kids in school from the beginning. And there's ways that we can do that. But I'm happy I saw that the Syracuse City School District is looking at more in-person learning. Most of the other districts I know are. So this is where we need to be. Kids are really having a hard time, and they're part of our most vulnerable population. We need to start addressing these issues and address them quickly.
You mentioned the vaccine eligibility could be expanded a little more, in your opinion. I saw Alaska opened it up to everyone, first U.S. state to do that. Do you think we're at the point where go get a vaccine if you want one?
So we're not there yet, Andrew. Alaska's got 700,000 people. We almost have that in Onondaga County. But you're certainly, I thought you could have did 50 and above, and I thought we could have activated manufacturing and activated agriculture.
Reporters.
Yeah, absolutely. You guys have been covering us every day. I think we're almost there. Because the supply is so great at the fairgrounds, at the pharmacies, what we're getting now, even though if there's a little bit of a race, that's okay. Before we had thousands and thousands of people going for 1,000 slots. I do believe that we'll get through this week coming up with the existing eligibility, but then it will start to get a little bit harder to fill appointments again. So I do think that hopefully next week the state will loosen up some of those requirements again.
Can you talk about the partnership with Essential Health? Whose idea was that partnership?
Yeah, they've been a great partner. We partner with them for testing, and they were doing a lot of mobile testing in the beginning of the pandemic for us at assisted living facilities and other senior centers. And so this is what they do, right? They're home care service agencies. So it makes sense for us because they know their clients, right? And so any of their clients that haven't been vaccinated, we'll give them vaccine, go vaccinate your clients. So that's a good model for us. And so I think we might have done that with St. Joe's Home Care too. And so we'll keep trying to do this. We might have, with this list that we're compiling, we might ask Essentia if they want to participate and help us vaccinate those seniors as well. And if they can't, then we'll put together our own mobile unit teams. But it's a great partnership throughout the pandemic. It's been one of the really meaningful relationships that we've developed in the healthcare industry.
You said on Monday when you spoke with Congressman Katko that he appeared undecided on the House vote for stimulus. He voted no. No Republican voted yes. Those are members of your party. Mm-hmm. I actually saw Chairman Becker in Madison County praising the majority leader, the Democratic majority leader, for the money to Madison County. So you see these, very traditional Republicans praising the Democrats without any Republican support on this bill. Your congressman voted no to the package that gave you money. Your thoughts on that?
Yeah, I thought the package had more good than bad in it. There's bad in it, but I thought it had more good. I'm not a one-trick pony, but certainly it was a good opportunity for bipartisanship.
It's the second Thursday in March. The last time you were at a podium, the second Thursday in March, you canceled the St. Patrick's Parade. What's it like to start reflecting on when the pandemic really hit Onondaga County 1 year ago?
Yeah, no, it's these were the anxiety when you look back around this week and next week around the whole pandemic. You're waiting, right? You knew it was coming, and you're just kind of waiting. We felt like we were prepared. We started making difficult decisions. We were, looking for data points to help validate decisions that we thought were necessary. So it's been a long year. Each part of this process has had its own pressure points, but certainly, man, this community's been through a lot and accomplished a lot in the last year. So I think overall everybody should be proud of themselves. They should be able to recognize that they've all gone through a traumatic experience, probably one of the hardest extended period of time where we've experienced trauma throughout this for an extended period of time. It probably won't happen again in our lives. So I think people should be proud of what they've accomplished, and certainly we need to remember those that we've lost and remember the lessons that we've learned about how we've been able to work together in unprecedented circumstances to accomplish extraordinary things. I think the latest allegations are very serious, and I think that I always do believe in due process, and so it's tough because I do believe in due process, but certainly it's Albany needs to function right now, and it's getting harder to see how it's going to function. So hopefully we'll see a fast investigation, or we'll see what the legislature does. But we need to have an active partner in Albany, and if paralysis is what's going to be there for pandemic relief, they need to do the right thing then and give control back to the local governments, because quite frankly, some of the where we are in this process, some of this is micromanaging at this point. We don't need anybody to tell us what time the restaurants need to be open till. We're the ones who do the work if there's a positive case there. It's in our interest to have smart, safe regulations. So I just think that if this situation doesn't get better soon, everybody in Albany needs to do the right thing and return the powers to the local governments the way that probably should have happened sooner than now. Anything else?
How badly would you have loved a Syracuse win 1 hour ago before you came out here?
I was salty for a little while, Andrew, after that loss. They played a great game, and it's tough in a game like that. Any game of inches today. So, but again, I think to the point for Joey Brackett's, Lenardi, and all these other folks who have us first one in, that's nonsense. To suggest that Drake or Colorado State or Boise State is better than us, it's just not there. So we should be in. It shouldn't even be a debate. It's about who we're playing. The team's playing well, and they should be pleased with their performance today, coming back off of a game yesterday and basically outplaying a top 10 team. I think it validated where we are, and hopefully we'll go on a nice little run. Anything else? Thanks, everybody.